Good day, global citizens. Welcome to another episode of Dr. Fademola's opinion. I always come with the adjectives. A good home to state, and I'm so happy to have you. It's an honor. In case you don't know, it's an honor to have you as the first female guest researcher on Dr. Fademola's opinion. Thank you so much for honoring the invite.
The high school, I was very curious about periods. So myself and my friends in primary six then would go behind the class.
And a facet of menstruation which people don't like to talk about, even though it's a problem. And even when people feel this pain, because of the stigma around it, they find it hard to talk about dysmenorrhea. And for those watching us who don't know what dysmenorrhea is, because they have menstrual pain is dysmenorrhea, anything that could do as a pharmacist. If you're not taking the patient's pain away, you are almost not doing anything. So pain management is very important.
Pain was so much, and every time I spoke about taking pain reliefs, initially I was made to believe that no, don't. If you take a pain relief, you will get used to it. You will get used to it, and then when medications and all of that, we have found alternative ways, so alternative medicines.
It's really good to the hospital or clinical settings to report of dysmenorrhea, let alone those in rural settings. And if they don't go, is what you have, is the statistics you have, that's what you document. If it's not documented, then you feel as if, even though people are talking about it in the community, even though homes are feeling it, you don't really feel like there is, it's really has an effect on the health of women in Delta State, not just Delta.
The pain was too much. So and it's sad that it's only in such extreme cases that they show up. Sometimes it could be normal, because in the course of doing this advocacy, especially around the time I did my bachelor research, bachelor thesis, it could be normal that this pain is like that. But other times it could be
the childbearing age from this paper, because poverty, dysmenorrhea, which one do you feel Nigerian women are more concerned about?
For period products versus the pain. You will not remember the pain then because of the embarrassment, and everything, which is really sad. So I think typically,
actually, the first time I knew about menstrual cup site exists from your foundation. So
wow.
Yeah. Thank you for the work you do in helping Nigerian women solve period poverty. Period poverty is a big issue in Nigeria, and now with even the worsening socioeconomic status of the country, like many people result into reusable parts, the sewable ones, and I want to use this as a platform to all relevant stakeholders. Something that happened when I was in secondary school was government. I don't know that it's Ministry of Health, but I just know it's the government. And they didn't do it for only my school in Abuja. They went around 100 schools in Abuja, to the best of my knowledge. And they were given sanitary pads to women. Many people took like 6, some people 5, you understand? One thing is, you can say sanitary pads are very safe, but when you say you are using reusable pads, how safe is it? Are you drying it under the sunlight? Are you washing it well? Which chemicals are you using to wash the sanitary pad, even though it's reusable? So in the long run, as a medic and personally, we are still talking about proper washing of underwears for women. Now we are moving it to sanitary pads. We are still managing underwears for women. So if that is not solved, actually as a medical advice, if you have the money, just buy the sanitary pads, because if you are not doing what you are supposed to do perfectly with regards to the reusable towel, reusable sanitary pad, you might get an infection or whatsoever. So this is a platform to all relevant stakeholders. Please invest. I don't know what happened, who was empowered. I can't remember who was empowered during that period or who was in charge to do that across schools in FCT. Please, commissioners for health, minister for health, relevant NGOs that can do that. We should. I'm not mentioning international NGOs because these are basics. It's not what are they calling it? It's not big projects for the country. Relevant
Mhm.
stakeholders, commissioners for health, please come up with ways you can provide monthly sanitary pads for the country, for the Nigerian women. I don't know why we have situations where you have free condoms. I feel free sanitary pads are priority because you can say you don't want to have sex, you can abstain from sex, but you can't abstain from menstrual flow. So instead of providing free condoms across the country, please provide free sanitary pads. They are priority. They are priority. And I feel why we have free condoms because we have lesser women in power. If more women are in power, I feel we'll have more voices talking for women and knowing that this is what should be done. But because men are the ones in power, they are solving their problems. I'm not trying to insult women, but they're solving their problems. Sanitary pads are priority compared to
Mhm.
condoms. So please, um, I'm optimistic that with platforms like this, whoever is in charge at national, state, and local level, we can have even though it's reduced price or free sanitary pads, Nigerian government has the money, free sanitary pads for Nigerian women, especially those going to
On. And I mean, slightly disagree with you on the topic of it's important actually that women have this period product, and then that they also have something sustainable. Do they have toilets where they can change in the schools? Are the toilets clean? Do they have water to wash their hands there, or to wash their period panties or whatever?
we are one thing is when you leave Nigeria and see and pay tax and see what is how the government of a specific country is using your tax.
Period products and pay for them. If you notice that the months you stress the most, you have more pains on those months. How much more a young person who's trying to, I say, women who have gone through childbirth report lesser period pains than women who haven't. But then that also becomes arguable in this age and
What are they calling it? I'll use it as an experience I've seen with some people close to me. I used to have some people close to me advocate for sex before marriage. So please don't say you edit from this platform.
reported abortion, came in. It was just, based on the data that was collected, and then, we began to associate. Oh, this person said this. Whether it's therapeutic abortion or not. Why does
Extra pain after a woman gives birth with life fetus, but those who have
hmm,
abortion, like there is no significant difference in